Aloha, everyone. We're going to go ahead and get started. I just want to welcome you all to the COVID-19 Public Health Action webinar. My name is Stephanie Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Today's topic is sheltering in place and social distancing practices, presented by Lieutenant Governor Dr. Josh Green. We have a few Zoom housekeepings before we start. For any questions or concerns, please utilize the chat box or question and answer box that is located at the bottom of your screen. For today's webinar series, we will not be offering any continuing education credits. Lastly, all webinars will be recorded and available on the Hawaii Public Health Training HUI's YouTube channel, and that is youtube.com/Hawaii Public Training HUI. I'm happy to introduce our facilitator for today, Trish LaChica, who is our policy director at the Hawaii Public Health Institute. And it is also an honor to introduce our guest presenter, Lieutenant Governor Dr. Josh Green. Josh Green is a local doctor, husband, and father of two who has spent his life caring for Hawaii families. After completing his medical training, he joined the National Health Corps and started his life's work as a family physician and ER doctor in rural hospitals and clinics on the Big Island. Josh served in the Hawaii State House of Representatives from 2004 to 2008, and in the Hawaii State Senate from 2008 to 2018, where he chaired the Health Committee and Human Services Committee. He was elected as Lieutenant Governor in 2018. So without further ado, I'd like to turn it over to Trish LaChica and Lieutenant Governor Dr. Josh Green.
Thank you, Steph, and thank you everyone for joining us today. Hi, Doc Green. It's such a pleasure to be able to speak to you. I've known you for a really long time, so it's always an honor to be able to have you have this space to be able to share your message. If you believe it or not, we have almost 1,000 people registered for today's webinar. So you can imagine just a lot of folks really eager to hear and talk about this topic. So let's go ahead and get started. We're gonna, I have some questions I'd like to ask you, and then we should have time to open it up to the audience for some questions, which I'll also be reading to you as well. So first question we have is, just a few days ago, Hawaii residents were recently given stay-at-home work from home orders by both our governor and different mayors. What can you tell us about, we're hearing staying at home, sheltering in place. What do these mean? And given your understanding of the nature of the coronavirus, why is it important for us to follow these orders given how the virus spreads?
Thank you. Thank you, Trish. It's fabulous to see you again in your professional role here. You are a star. And thank you everyone for coming aboard today. Sheltering in place, also home quarantine is one way to look at it, okay? Just let's be very clear. We are in a critical situation. COVID-19, coronavirus disease, that's the D, which is a pneumonia, 2019. We have no immunity to it whatsoever. So that's why it can run through the world pretty much like a hot knife through butter. And as we all know, it can be fatal. We have 438,749 confirmed cases globally right now, and you can be sure that there's tens or hundreds of thousands additional cases without any doubt. We have 55,245 cases confirmed in the US and 95, we're at 95 now in the state of Hawaii. The only way to suppress this kind of disease, and it must be suppressed, even stopped if at all possible, has been through very, very significant social distancing. Now, being a state that can actually shelter in place, because we're very isolated and our people under this circumstance have very little to do because we're gonna have no tourism here, we must do it. If we shelter in place successfully, and in this case, we're asking people to effectively go through April 30th, which is what I was calling for, and I'm glad the governor went for, we will be able to truly flatten the curve. And I'm gonna get into why we have to do that from a public health standpoint. We have not seen widespread community spread yet. to our knowledge. Of course, our testing was very, very limited. And we only tested a couple hundred people with the Department of Health and the CDC tests. And that was a great strain on us because we had to get testing out there to have some idea of the background, let alone actually test people who are sick. But sheltering in place by staying home and only going out, and I mean only going out, if you need food or health care, that will work. It will be very good if we also have social distancing, meaning don't get any closer to anybody than 6 feet because of the spread pattern. We're talking about droplets. We can actually see our numbers drop to nothing. And then we also have to have the mainland and Europe and Asia drop to virtually nothing, because if they don't drop to nothing, and then everyone decides it's a great time to go to Hawaii, we'll of course see spread again because we have no immunity. We want passive immunity to begin over time. I want to share a couple things, if you don't mind, based on this pretty wide open-ended question right off the bat, Trish, and that's what our healthcare capacity is. Now, some of these numbers you probably have heard, but I'm going to reiterate them for this crowd because I think it's very important that you hear them. Statewide, we have 3,031 licensed hospital beds, 3,031. As recently as 48 hours ago, we were only at 65% occupancy, and that number has stayed stable. That means 1,970 people were in our 3,031 beds. So we had 1,061 beds available. And we do have a surge capacity of 15%, which is another 437 beds. So we had just under 1,500 extra beds if we had to have them. Now, they're not all ICU beds, right? We only have 328 ICU beds right now. Some of that surge can become intensive care unit beds because what we do is we cancel elective surgeries and we have those surgical theaters with vents, which can be essentially ICUs. We have 204 negative pressure isolation rooms and about 561 ventilators. Now, imagine this for a second. We've got these 3,000 beds and we have a 1,500 bed capacity if we had to take care of people. Well, if a half of our state, 700,000 people, if half of our state became positive with COVID-19, and if the rates held that approximately 5% of all the people that get COVID-19 become severely ill enough to go into the hospital, that would be 35,000 individuals that would be severe enough to go into the hospital. And half of those people across the world have been on ventilators. That means you'd have 17,500 people needing ventilators, and we have 561. So you can imagine what that would look like. That would look like Italy, where they're now reporting that anyone over age 60 is not going to be recommended for mechanical ventilation. That would be fatality after fatality after fatality. So the idea of doing social distancing is, instead of letting this thing run through us real fast spike and then down, and in that fast spike, we have to watch everybody die in the hospitals because the mortality rate is quite high for seniors. We talk about that. We spread it out very slowly like this. And so we only have a tiny little ripple. Like when we get a false tsunami alert, and we get that tiny little puddle, that's what we want. We do not want a tsunami that comes and wipes out Hilo, in the case of Hilo when it had the tsunami years ago. That's why we have to do social distancing. That's why behind the scenes we have to prepare our intensive care units in our hospitals. And just maybe we'll come out of this okay with a small ripple. But New York has shown if you don't do that, you get crushed. So has Italy. So that's where I wanted to start with things. And I think that everyone gets the idea that good sheltering in place, good social distancing, don't use the loopholes. Even if you qualify for them, do not use them, because you will get the disease and you'll spread it, and we will not have this small little bump. We'll get a big spike.
Thank you. Thank you so much for those much needed numbers, Doc. You started talking about how necessary it is for us to flatten the curve. And we've seen in countries like China and South Korea where they have been successful in doing that. In fact, I think China hasn't seen new cases recently. So what does it mean to, flatten the curve, and what should we be doing here in Hawaii to help slow, as you said, the spread of COVID-19?
Okay, so the way to flatten the curve, and I do appreciate the fact that the governor made the decision to go with the 14-day, first of all, travel ban. Essentially, anybody who travels to the state of Hawaii, they're not going to want to travel here actually beyond 14 days because they're going to have to quarantine, and they're going to have to stay in their hotel rooms or Airbnb, which is kind of a preposterous idea for anybody to do that. So the gov made a strong recommendation. It was good. Obviously, I was calling for it about a week before, and a lot of these things either take time or is a very difficult decision to make socially and politically. It almost never happens. So that is a very, very important move that was made. So that's the number one thing we can do. If we want to flatten the curve, we've now stopped all travel here. And of the 95 cases, I believe 91 of them have been direct travelers, and a couple other people were, somehow connected to a traveler just by one or separation, right? So by stopping travel and watching the disease roll through the rest of the world, but burn out, as coronaviruses tend to burn out after, say, 10 to 12 weeks, we could get away with a very light crush, a very light surge, and then down. That's what we are praying for, because if that happens, there will be global immunity that begins. We will begin to see essentially some passive immunity like we got for SARS and MERS and so on, and then we're going to be okay. That's what we've got to do. The other things that we can do is we can be very, very diligent about not ever going out when we're sick, not going to work when we're sick. Even after this is done, there's going to be some COVID-19 around, I suspect, because we're not testing everybody and we simply don't know. So there will be little pockets of it. But at that point, the density of disease will be so low that what we'll want to do is we will want to really, really reinforce. If you're sick, don't go to work. If you're sick, don't go to school. If you have any illness or symptoms at all, do not go near our kupuna. Because if you do, they're going to catch it. And the mortality rate for people 75 to 79 is 8%. And the mortality rate 80 and above is 14.4%. Right now, the mortality rate across all ages is 3% when averaged. And you can be sure when our denominator goes up, the mortality rate is going to go way down. So it'll be viewed in the subsequent years as the bad flu. And that's going to be tough to deal with, but it's not going to be a global pandemic in coming years, I don't believe. So do the social distancing, shelter in place, and if I can be your kind of blunt big brother here, take it from me, we have to be brutal about that. That will help.
Thank you. Doc, you mentioned, Hawaii is at 95 cases right now. And that number will continue to exponentially rise over the next couple of weeks. There's also a lot of different messaging around testing that the public is hearing, and on who needs to be tested. And from what I understand, the states it really needs to prioritize our testing resources because we simply cannot get everybody tested. So what are your recommendations around testing for COVID-19?
So there's a couple, we put together some pretty clear guidelines now. People who get tested should be symptomatic or through a significant clinical decision or in heavy proximity to an individual that was positive. Like you were with someone for 2.5 hours, that was positive for coronavirus, and there's a reason to test you. We also are going to test healthcare professionals more rigorously, because if we have any suspicion that a healthcare professional is sick, we have to have absolute certainty that they're not taking care of a lot of patients. So really, the clear guidance has to be you only need to get tested if you are symptomatic. And 88% of all people who have COVID have fever. Then it drops off to shortness of breath and dry cough. So the recommendation, don't get tested if you're asymptomatic unless there's a real serious reason. And most likely you will test negative anyway if you're asymptomatic, because people's viral load does not go up significantly until their symptoms are coming. There are some outliers. Of course, some people would be positive a few days before or after the disease symptoms come through, but it's not worth it. Now, we actually have thousands and thousands of tests that have arrived. So we do have the capacity, but we have finite human manpower to test everybody, and we are still sending some to the mainland. Our local labs are now able to test within the day, though. So we're getting there. We need a lot of testing, or needed a lot of testing, probably still do, to get background ideas about the disease. For instance, we need to know in each region how many people are positive, because we have to anticipate what will that look like if there's community spread from them, and what do we have to prepare our intensive care units for, and where do we have to deploy resources like extra ventilators. So there's very good reason to test, and we have to make sure that we're ahead of this. It is the least expensive part of this whole plan. I can tell you that because I'm right now gaming out building a 1,000-bed facility at one of our main institutions, perhaps at the convention center. And if the Army Corps of Engineers does that with FEMA, it's going to cost $145 million, of which 75% will be paid by the federal government. So it's better to test a couple thousand people and know exactly where we are rather than be kind of tilting at windmills in the dark.
Thank you. And I think the big message too is we do not, as you mentioned earlier, we do not want to overload our healthcare system and suddenly get everybody to the hospital where they're more at risk. I think the next question is about your role as, a primary care provider, an ER doctor. What you did mention some of our capacity with beds, but a lot of folks, about 900 folks I can see on right now and have been asking questions, are coming from, the health industry, public health, hospitals, health plans, community health centers. What is our role given the limited resources the state has, but what should we do to help relieve the burden, from our healthcare system?
Well, you just gave me a good reminder. First of all, be prepared to work hard for the next 6 weeks. You work hard all the time, so it should be easy for everybody on this call. We may have to form and kind of bring back together our Hawaii Health Corps, because we did an extraordinary job when we went to Samoa, and I think it's coming time where we may be asked and called into action, whether we are a social worker, a nurse, a physician, a public health expert, any number of outreach coordinators, so many people on this call, and epidemiologists, everybody. We might be called into action, if we'd like to be, to provide support services and clinical services together at a couple different sites. So do me a favor. We've started the Facebook page, Hawaii Health Corps, and that's CORPS, Hawaii Health Corps. Please go and join that thing and become part of this volunteer corps. I don't know whether it will get fully activated, but then we can all communicate kind of in unison when we want to. That's one thing. Number two, it's going to be extraordinary if we set up these kind of facilities, not just perhaps 1,000-bed capacity if we have this super surge at the convention center. We're also talking about dealing with the homeless crisis and helping people to accomplish social distancing. Because if it breaks out, if COVID-19 breaks out among the homeless, we're going to have to give people somewhere to rest, possibly in hotel rooms, but more likely in a socially distanced space that we provide comfort and supportive care to them in their tent or where they're staying. One idea is to use the Blaisdell and those two ramps where we give people 12 or 15 square feet, 15 feet on a side, some cushions and a proper sleeping bag, and then bring food, water, and nursing care. We may do that as well. So these are some of the ideas, plus someone has offered a football field size large tent where people could rest in place. But all of these things would necessitate a major health corps outreach. The HIPHI folks, the military, only have a team of 253 people statewide. Now, of course, if they had to call up the National Guard, they could get thousands of people, and they have lots and lots of quite strong individuals that can do a lot of different things. But we as healthcare providers and healthcare experts would have a much larger role to play. And I really think this is the time, and I'm honored to be a part of this with you, where we put the Hawaii Health Corps together. So if you don't mind, please all sign up on that on Facebook. You can also go to, if you don't also mind, go to my social media. It's at LTGov Josh Green, at LTGov Josh Green, so I can communicate seamlessly with all 1,000 of our people. Someone writes here, I'm not finding Hawaii Health Corps, CORPS, on Facebook. We'll make sure it's there. We were working on it this morning. I know it's up, so forgive me if it wasn't there easy, but we're going to find it for you. And then, yeah, and that is very helpful on the social media, because I want to be able to communicate in real time. We won't torture you, but we're going to have some awesome opportunities to all come together, whether it's here for the COVID crisis or in the South Pacific. We took 76 people to Samoa, and it was a life-changing experience. And I honor and thank many of you who were able to come.
Doc, there was a question that came in about proper isolation. So for folks that are, have tested positive, but are either being sent home or live in like let's say a public housing, building, or in a community, like what should we be, what are the steps to really provide proper isolation?
So you got to isolate at home. That was the, I don't know. Yeah, we'll let the God was calling me, but we're good. So the isolating at home, you got to stay away from everybody for 14 days if you test positive. 14 days. That's the absolute necessity to express. We may ultimately set up some capacity for people to be away from their loved ones. That would provide some relief. But it is very difficult to set that kind of thing up when we don't have support services and wraparound services. So if you test positive, it's 14 days. You should wear a mask at home, or you should certainly be in a room if you have that capacity away from your loved ones. And you spend very, very limited time in contact with them, because they will then convert and test positive, and then it'll be a mini outbreak, a cluster. So that is a worry I have. But the best I can tell you is it's going to be imperfect, but the volume, if it stays this low, really low, then we're going to be okay. I'm going to have you pause for 1/2 second. Jordan, see if I have to jump in on the Gov thing, and then I can give these two guys 3 minutes break, and they can then call me back. So what I'm thinking is that if we keep these numbers very low, we went up 21 yesterday. We only went up 5 today. We have been testing pretty comprehensively, and people are clamoring for tests. We could see a little surge and a drop off. That would be the very best scenario. And then we ride this out like you can't believe, till we get to 0 cases effectively over the course of the next 36 days. Then we're fine. We will have to be very mindful as people travel. I would guess that isolating at home situation will not be something people want to revisit. So we'll probably test people when they come back into Hawaii for a time. And they won't love it, but believe you and me, it's a much better way to go than having a state get overrun by COVID.
Thank you, Doc. For us working on prevention and public health, there's a lot of questions around how do we, as folks, follow the stay-at-home orders, as folks do go out for essential things such as going to the grocery, how can they, prevent and, both the spread, but also keep themselves protected from the virus? Folks are asking, should I wear a mask if I feel I want to wear a mask? Should I wear gloves, or is it enough to just disinfect anything I've touched, after my hands after I've touched something, or I'm out before I enter the home?
Well, if you have very limited contact with people, let's say you're going to the grocery store, right? And you're wary because you have to go get food. You go there, you definitely practice social distancing. They're actually implementing social distancing at the grocery stores. You wash your hands after you have the experience. Wearing a mask actually does help because it prevents you from touching your own mucous membranes. And there are still people out there picking their nose, touching stuff, in spite of what you would imagine would be taboo right now when we have a lethal coronavirus floating around. So the best you can do is you go afterwards, you wipe down your groceries that come, and you wipe your hands down. Having that mask is somewhat helpful. A surgical mask keeps very basic containment. It's really mostly for you to prevent coughing or sneezing outward. The rest of the masks are the effective ones. That's the N95s and the N99s. 95% of the particles for N95s, 99% of the particles from N99s. There's been an extreme shortage, but we received a 20 pallet order of PPE, 20 pallet order that's going to mostly go to healthcare, to the hospitals, and hopefully to some of the community health centers, and then to the community clinics. That's now going to be available. And so we do have to be in touch with the Healthcare Association of Hawaii. We will try not to bury Hilton Raythel with calls and texts and everything, but they do have a staff there, and that's our central repository of materials. We're also doing a collection here at the Capitol on Friday through our office to bring in extra PPE from the main folks that do construction. So all of that, very, very valuable. And I'll tell you this, if you do decide to go out because you absolutely have to, it's okay. You're going to be safe. But if I won't be able to focus. You have to have a headphone, I'm sorry. Yeah, if we do if we do have to go out, the likelihood, unless you're directly in contact with someone who's symptomatic and you're there for in a direct kind of line of fire within 6 feet, you're not going to get caught with it and catch it. Best you can do, though, don't get near anybody.
Thank you, Doc. We'll share all of the resources you've been sharing, as well as information for PPE drop-offs to everyone on the call.
Yep.
You've also been advocating a lot for our vulnerable populations, being for the state to be able to prioritize both our homeless and kupuna and folks with underlying health conditions, mental health. What is your message on how we can help prioritize these populations?
So, thank you. Yeah, our vulnerable population are people who are dearest to us who have been struggling. And I'm kind of speaking about the homeless community. There are a lot of homeless families. Still 25% of our homeless community are children. The key there is that we must help people to not be scattered to the wind and to be basically swept. The CDC announced their protocols on that, and they said that sweeping homeless individuals now is a mistake. Sweeping homeless individuals elsewhere spreads the disease, so people should be asked to stay at home. And if they stay at home, then which is to say, stay in their camp or their tent, they're less likely to spread the disease and get sick. So we take services to them. We are talking about, like I mentioned earlier, a couple large areas where we could bring people into general regions, but not have them infect one another by giving a little bit of distance and then have services. We've appealed to the mayor's team to keep bathrooms open so that there's basic hygiene. We don't want people, imagine if it's hard enough for me or you to get some soap or some hand sanitizer. Imagine what it's like to be homeless. And then add on top of that, if there's not a proper bathroom or shower to go to. So we will be increasing our capacity at the H4. Mayor did a good job actually increasing their capacity at the hygiene center down on Kawili Street. We're opening a space that's 26 rooms, which I believe is did I say it earlier, Ka'ahi Street. And our team of professionals there, you should contact Andy Muntangdi over at the H4 if you're looking for work and you want to do something in the healthcare field. That is an area that is both necessary and valuable, and it's going to be some hygiene, some cleaning, and some public health. So Andy's number is 230-3069. That's 230-3069. And if you'd like to volunteer for the H4 or work with them, they've received some grants right now to take care of those who are struggling.
Thank you so much, Doc. So at this point, we are taking in questions from the audience. I'll be reading them to Dr. Green as they come. And while we wait, we also at Hawaii Public Health Institute and the Hawaii Children's Action Network have formed a public health action just a network of folks organizing around food distribution, different health needs and just policy, needs. So and research, and so we'll also share that resource information with you after the call.
And I love you guys, but they're gonna yank me at 105. So I'll do speed dating answers. You ask questions, I'll be fast.
Okay. Is there a plan to consider bringing in those who are ready to graduate from medical school to assist with the outbreak?
There's not a formal plan, but I love the idea, and they should all join our website, and the dean can send me, or Lee can send me a recommendation. I spent my last 6 months of med school doing that, so I think it's a great idea.
Childcare providers continue staying open. Any advice for those that are still open?
I'm very reluctant to advise them to stay open. It's pretty tough. You're going to get spread. It's going to be tough on people, but everyone's going to have to, unfortunately, deal with best they possibly can, setting it up where their kids can stay at home with a member of the family, whether it's a parent or an auntie or an uncle. We're going to see spread otherwise. The only way this works is if we have true social distancing.
How can dentists help? We're all unable to work in our current capacities, but we're fully trained in infection control.
Dentists are another emergency only service probably right now. It's very difficult because you're going to definitely catch COVID-19 and spread it if you are with patients and you don't have a lot of PPE. And so it's at least it's only 35 days. Pray for an end to this. But I know that dental services are going to be minimized. If someone has a dental emergency, that's a health emergency, take care of them.
Are there any mental health supports being offered for those needing the services in this highly anxious time?
We're going to need a lot more of that. I'll tell you, I was mentioning there's going to be anxiety and depression because people are stuck at home. And we can do telehealth, telemental health. Dr. Roth is a very good resource. Dr. David Roth, I would reach out to him. He does telepsych. And also, we are going to actually see a big expansion of telehealth services in general. There are some hotlines. You can call 211, but pretty much everyone's thinking about COVID instead of depression or suicidal ideation or what have you. It's an extremely tough time. You should still utilize the ER if you have that problem.
And then just to clarify, you are accepting on Friday PPEs as well as the homemade fabric masks on Friday?
Yes, I am. So people can drive by at the Hawaii State Capitol anywhere between 8 a.m. and 3 p.m. on the Father Damien side where there's that little pull-in, and then we'll be able to take them from people, and we're going to do great thanks to you, and we might do a social distancing picture if you'd like, but I want to thank everybody who's doing that already. It's been quite amazing. I've been able to give thousands of face masks and other PPE out, to be honest, right to the community that's taking care of those who are homeless, because those are the people I hang out with. But they are healthcare providers, obviously, like so many. So thank you for that, and your generosity will be extremely well received.
Okay, I'll leave the final message to you, Doc, before you hop off. I think if everything, if we are very effective in this sheltering in place, do you see an end in sight in terms of, when this will be over, and what's your final message to the community watching today?
Well, I think this ends on April 30th, which means a whole lot of babies are going to be born 9 months from now, I suppose, which is the good news. The bad news is we're going to have a shortage of OBGYNs to deliver them. So everyone keep in school and keep socially isolated, because we are not going to get through this easily, this COVID thing, but it probably ends in 35 days. Beyond that, just really be serious. You're 1,000 people strong. If each of you reaches out to your network of 1,000 or 1,500 people, you get to everybody in the state. Absolutely shelter in place. Tell people to not go out except to get groceries, except to get health care. And honestly, you don't even have to get that much health care because people are staying home and laying low. That's the main message. And we will see a lot of important impacts from this. We will see that we can survive through an economic crisis. We will see that certain needs to travel constantly are not really quite so urgent. And we will actually see that some of our healthcare systems improve, like with telehealth and video conferencing. We're going to get very good at that. Most importantly, though, let's not spread this disease at all, because if we don't, we will have the capacity available to us at our hospitals so that we can take care of any of the spikes that we might see. Don't be surprised if there are a few bumps in the road after the April 30th deadline, mostly because I think much of the world is going to begin to get over it, and we will be mindful that there's not a gigantic influx of people that are not confirmed negative. That's not going to be easy, and there's going to be fear for some time. But I don't want you to be afraid. I want you to know that I'm going to continue to message this very clearly. We are going to test symptomatic people. We're going to conserve our resources. We're going to stand up the intensive care unit beds as we have to. We have the military on our side and ready to act. And really, just know that you're so valuable. Message and information is every bit as powerful as the intensive care unit capacity and the ventilators if we prevent spread. And that's why it's great what you're capable of doing. This is an extraordinary crowd of very high-powered intellectuals. I want you all to use that to your advantage. Share these messages. Tell people to be serious. And then in 35 days, we'll come up for air. Again, thank you. If you don't mind, do join our social media the best you can so we can all communicate. We'll have lots of time to get together, and I'm happy to do this again in 2 weeks if that helps.
Thank you. Thank you so much, Dr. Green. And thank you so much for spending time with us and inspiring us for the work that we do. We love you.
You guys are great. Thanks for everything, guys.
I'm going to pass it on now to Steph, who will be providing just some helping to close the webinar today. Thank you, Steph.
Thank you, Trish. Again, I just want to thank Lieutenant Governor Dr. Josh Green for taking time out of his busy schedule. Mahalo for being here with us today. Mahalo to Trish for facilitating, and mahalo to all of you for joining in the webinar. We are hoping to do this weekly, and next week we are currently trying to put together a webinar to feature 2 to 3 frontline healthcare workers. But please watch your emails for an email to be sent out with details as well as a registration link. Stay safe, everyone, and hopefully we'll see you next week. Thank you.